Hi guys, welcome back to my channel. This is Sagnick Dutta. I'm a final year MBBS student at Bardwan Medical College and Hospital, West Bengal. This is another subject review video, but this time it's a third year subject. I'm going to talk about the subject called as Forensic Medicine and Toxicology. Now this is going to be a very short video because the subject is a cute little short subject which can be dealt with very easily. But if not done in a proper way at a proper time, it can turn out to be Herculean as well. So without much ado, let us get into the video. I've divided this entire video into 4 sections. In the first section, I'll be talking about the books. In the section 2, I'll be talking about the video lectures and the notes. In the third section, I'll be talking about the important topics that are important for this subject of forensic medicine and toxicology. And number 4, I'll be talking about how you should actually practice your questions for this subject. So coming to the very first section, that is the book. The only book that I would actually recommend for this subject is called as The Essential of Forensic Medicine and Toxicology by Dr. Reddy. Now this is the standard book for this subject which you should refer to. Look, for the subject of forensic medicine, you do not need to refer to every book or the book in its entirety for this subject. What I mean by this is you need not to study this entire subject starting from the first chapter to the last chapter from a book, which I would suggest for other subjects. The reason for that is in your third year of MBBS, you have other mammoth subjects like PSM, which you should invest more time upon. This is a very rewarding subject. Putting in less effort can give you good marks in this subject. So this subject is something which you should not refer to for books. And why I say that, because the informations present in other resources which you will be subsequently dealing with are more than enough for this subject in itself. So you need not to have a read of the entire book for this subject. But what I really want to talk about in this subject with respect to the books is, look, this entire subject is divided into 2 sections, the forensic medicine section and the second is the toxicology section. Now toxicology is something which is mammoth. For example, whatever we do not eat, whatever is not a good eatable are poisons basically. But we need to refer to some specific poisons which you should refer to from this book. Apart from that, from the forensic medicine section, I would ask you to read at least the sexual violence section from this book, because that is something very important. Now coming to the next section, that is video lectures and other resources that you should use for this entire subject. I have been a subscriber of the Cerebellum Academy, and here Dr. Atul Gupta sir teaches forensic medicine. And trust me with this has to be one of the best forensic medicine notes out there. I have been using this inadvertently. The entire forensic medicine I have prepared from sir's video lectures and the notes. Now what are the things that I did? First, I watched the video lectures, then I referred to the notes simultaneously and revised these notes time and again so that I could write answers. Now what I really like about these notes are, number 1, the differences and the important topics and subtopics which are as such asked in the questions are written as such in the book. For example, I would take an example such as the difference between caput succedaneum and cephalhematoma. That is given in a very tabular format, the difference pre-made in these notes. You just need to read that, revise that, learn it by heart, you are good to go. Apart from that, the important IPCs, CRPCs which was previously called and now these are called as BNS, BNSS and etc. are also dealt with in a tabular format which helps a lot. So I would like you to recommend that you study this entire subject of forensic medicine from the pre-made notes that are available from your coaching institute, which are more than enough for your university exams. Now let me take you to my screen so that I can literally deal with the important topics for this subject. I have divided this entire subject into 2 sections, the forensic medicine section and the toxicology section. I'll be talking about each chapter specifically and what are the important topics in each chapter. Now coming to the very first chapter, that is legal procedures. Now this chapter specifically deals with the legal system related to medical field. Now, initially we used to talk about IPCs, CRPCs and the Indian Evidence Act, but at this point of time these are absolutely not needed. What we need to know is the BNS, BNSS and BSA. Now, for this you should always refer to the updated notes of your coaching institutes, because they must have updated the IPCs and CRPCs into BNS and BNSS, so you should learn only them. Now look, these no one is asking you to be a lawyer. You don't need to literally learn and mug up every single thing. Learn and understand only those BNS and BNSS which are important for you as related. So you need not to actually invest your entire time into learning thousands of BNS and BNSS. For example, you are studying something about rape, which is included in the sexual violence chapter. When you are studying that, study the BNS and the BNSS related to that. Do it like that. That would be more than enough for you and you would remember it easily as well. Now, getting to the next other topic which are important in this chapter are summons, which you need to study the definition and types of summons. The next is inquest. You need to know the types of inquest and the procedure of a police inquest. The next is witness. The difference between dying declaration and dying deposition is something very important. Now, talking about the evidences, there are two types of evidences, oral evidence and documentary evidence. You need to know the differences and how they are acceptable, whether they are acceptable or not, when are they acceptable, which one is superior, which one is inferior. You should know everything about the evidences. Then we should know about the hierarchy of the Indian court system, the Indian legal system. Now, coming to the next chapter, that is medical laws and ethics. Now, these deals with some important definitions. For example, the forensic medicine definition, medical jurisprudence definition, medical ethics definition, medical etiquettes. These four definitions should be learnt by heart because these are of utmost importance. Now, getting to the next important topics like difference between infamous conduct and medical negligence, types of medical negligence, the defenses a doctor can produce against a case of medical negligence, and the medico-legal doctrines. There are around 10 to 12 doctrines. You should learn them by heart. So with this, these first two chapters will be done. Now, my suggestion would be to do these two chapters at last after you have completed all the other chapters, because when you start studying the subject, you would find these very monotonous, because these are not something directly related to the subject, rather is a part of the subject. So you should start with the third chapter, that is identification. Now, this chapter of identification would be something which would actually make you remind of the subject of anatomy. A little bit of knowledge of anatomy would be something needed for this chapter, and moreover your practical portion would be also dependent on this chapter, where you would be given a sample of a bone and you will be needed to determine the age and sex of that particular sample. So that is something very important and is a little related to the subject of anatomy. You don't need to know the entire anatomy, but a part of it. Now, what are the important things that you need to know for this case? Number one are the race. There are different indices like cephalic index, which you need to learn by heart the formulas of it. The next is age estimation, of which the part is dentition and bones, the ossification centers. You need to know the Krogman's formula. The Krogman's formula is nothing but basically a percentage accuracy table which is given already. Like if you get a sample of bone, what's the percentage accuracy of determining the age and sex of the particular bone using that bone itself. That is what the Krogman's formula determines. Now, talking about the difference between male and female bones is something which you should importantly do, and the most important part of this identification chapter is the fingerprinting. The types of fingerprints and the ways of collecting the fingerprints is something which you should learn by heart and is of utmost importance. Getting to the next chapter, that is thanatology. The types of, now this is the most important chapter of your entire forensic medicine section, because this is the basic and crux of forensic medicine that needs to be talked about. What are these? We need to know about the types of autopsy techniques, evisceration techniques, antemortem and postmortem clots, types of death certificate, and the most important being the early changes after death and the late changes after death. Now, for these, while you are studying the late and early changes after death, what you should literally do is you should learn by heart the timeline, like from which hour to which hour this change is seen, this particular change is seen. That you should make a table of yours, and hopefully that would be given in your coaching modules. Learn it by heart. That is of utmost importance. Getting to injuries, the most important section of injuries is its classification. Next is abrasion versus bruise, types of wounds, pedestrian and automobile injuries, skull fractures. Now these are things which you can avoid but do at last, not initially. Ballistics is not important. It might sound interesting, it might seem interesting, you might read it interestingly, but rarely questions are asked based on these topics. If anything is asked in these types of injuries, that would be an entry and exit wound. The sixth topic is asphyxia. This is a very important topic because most of the questions are related to this, and the basic things when you start with forensic medicine is related to asphyxia. The basic thing is the classification of asphyxia, difference between hanging and strangulation, and different types of strangulations like manual strangulation, ligature strangulation, and the most important being types of drowning. This is something very, very important. Even in our university questions, we got a case of partial drowning, which is a type of drowning, and related questions of 15 marks. So it is that very important which you should refer to. Now, the next important thing is thermal injuries, out of which you should give some importance to burns, the surface area, the Wallace rule, and the London Bowder rules. Now these are something which will be again reading in your final year in your subject of surgery, but if you just read it here, that would be one step ahead towards your surgery subject. Now comes the next important chapter, that is sexual offense. The definition of rape, BNS and BNSS, as I said, is important for this particular chapter. The examination of rape victim, signs of pregnancy, timeline and abortion, all of these are very, very important for this particular chapter. Now coming to the next part of forensic medicine, and that is toxicology. The general management of poisoning, general management of toxicology, that is A, B, C, D, E, is something which you should learn it by heart. Then the chelating agents, these are a part of the general toxicology. Then let me just get into the specific toxins which are very important. Number one is opioid poisoning, alcohol poisoning, dhatura poisoning, oxalic acid poisoning. These are all acidic poisons which you should remember. Now getting to the next thing, these are metallic poisons, that is arsenic and thallium, mercury and lead are very important, and even important with respect to your practical exams, because the samples of these two metallic poisons would be given. You will have to identify the case based on that, and that is why it is very, very important. Copper is also important. Among non-metallic poisons, phosphorus is important, and snake bite is something which is very important. Even when you get to your final year in your medicine, subject of medicine, snake bite becomes important. The types of snakes, the examples of snakes, how their venoms work, and how do you actually manage a patient of different kinds of snake bites is something very important, because you look, this is something which is very prevalent in India as well, and that is why it is important. You need to know these. Now, plant irritants are not so important theoretically, but you should always see the images of these sections, because that becomes important for your practical part. So with that, we come to the end of the important topics for the subject of pharmacology. Now let us get to the final sections, that is how should you practice questions. Look, forensic medicine is a very specific subject. You need to know the name of the toxins, their main toxic components, how do they work. If you just talk about forensic medicine, what are the respective BNS and BNSS, what is the definition of a particular term. So these are all very specific things that you need to know, and for that I would actually recommend you to study and understand from the question banks. Whatever coaching you might be enrolled into, you should actually solve the question banks of that particular module. I myself have solved almost 70 to 80% of the question bank for forensic medicine, and that turns out to be something very beneficial. You get habituated to remembering specific informations for that particular subject, and that is why solving question banks and specifically solving MCQ questions is something very important. Apart from that, solve the previous year questions of your university and get hold of the types of questions, types of repeated questions that are being asked for this particular subject, and with that we'll all be completely done. I hope you like this video, and I hope this video has been helpful to you. If it is, hit the like button, subscribe to the channel and share this video with whomever might find it helpful as well. Thank you. See you in the next one. And in the next video, we'll be talking about preventive and social medicine, the most dreaded subject of third year of MBBS. Thank you. Bye.